Senator Baldwin at the Gundersen Pharmacy in Onalaska this afternoon on a bus tour right now, promoting recent federal moves to help lower costs and improve health outcomes. News 19's Crystal Flintrop has our top story.
People need these drugs. They need these drugs to maintain the quality of their life.
In 2020, more than 33% of Americans saw their out-of-pocket medication costs increase. And with these higher prescription prices, it can be difficult to afford the day-to-day costs.
I have to pay a large amount between co-pays, and you get in the donut hole, and that's thousands of dollars right there. I do cut corners. I make sure I try to keep my costs down at home so I can afford my drugs. I keep the temperature low in the wintertime. I use time of use, lower electric rates.
And in extreme cases, cutting corners can have dire consequences.
The soaring cost of prescription medications have become a burden for our patients. Because of these hardships, people are forced to skip doses. They cut their pills in half, or even skip their treatment altogether. This is unacceptable. We know it's only a matter of time before these patients come into our complications in our emergency rooms with complications and health issues that very easily could have been avoided.
These are just some of the reasons Senator Tammy Baldwin fought for the Inflation Reduction Act, in turn lowering prescription drug costs.
We are finally giving Medicare the power that they needed to negotiate lower prescription drug prices with the pharmaceutical companies. This will not only cut drug costs for Americans, but it saves taxpayers hundreds of billions of dollars. We also capped the cost of insulin for seniors on Medicare at $35 per month.
But the fight is far from over. Senator Baldwin says she's fighting in Washington to pass legislation to cap the cost of insulin for all Americans who rely on insulin. In Onalaska, I'm Crystal Flintrop, News 19.
This August marks the one-year anniversary of the Inflation Reduction Act, and in 2025, seniors on Medicare will see their out-of-pocket costs for prescriptions be capped at no more than $2,000 a month.
All right.